And we turn now to a KION investigation. What led San Benito County to suspend COVID-19 vaccine doses to their largest provider for more than a month? We know that they're accused of giving the vaccine to friends, family, and other groups out of turn. In an interview, the Health Foundation says they did nothing wrong. KION anchor Aaron Groff has spent the last few weeks digging into this story and has this special report.
I have here more than 30 pages of correspondence between the San Benito Health Foundation and the San Benito County Health Department over just the last 2 months, and a list of complaints the county sent to the state. So I wanted to learn, what are these accusations, what are the reasons given, and what do the vaccine guidelines actually say? After more than a month, COVID-19 vaccine doses are finally being sent again to the San Benito Health Foundation, the largest vaccine provider in the county. The foundation is a key part of the county's vaccine effort with an expansive list of low-income minority clients. A public records request by KION uncovered this January 22nd memo from County Health to the California Department of Public Health. Claims included the Health Foundation giving the vaccine to people outside the eligible tiers, which at the time was only healthcare workers and people 75 and older.
And every vaccine that goes to somebody who isn't in the tier yet means that somebody else doesn't get that vaccine, and it's a risk of, serious illness or death.
The county sent a notice to the Health Foundation a week later, suspending their vaccine allocation.
We don't know who accused us. We can certainly speak about the allegations that we know about, but we don't really understand what the county's process was.
The county says they had documented reports of the foundation's preferential treatment to staff member families, friends of friends, and clients. County Health is largely upset over significant orphan or unused punctured doses, which records show accounted for 9% of the foundation's supply, allegedly much higher than other providers.
To me, suggests either very poor planning or it was intentional to have orphan doses. It's not who you know or how you're connected. That doesn't determine whether you get vaccinated. It's whether you fit in the tiers or not.
The foundation blames orphan doses on no-shows and a storm. And as for who got the vaccine, they had their own targeted and often hard-to-reach populations.
It's not reached by internet and look at a website and sign up and wait for your turn. It's not how we engage this population. It's to people that they trust, that have been there for them in the past.
But the complaint also mentions vaccinating members of the San Juan Bautista Rotary Club. Fernandez is a past Rotary president. The Rotary's current listed president is on the Health Foundation board, as is their executive secretary, Art Testani.
Volunteer work, distribution work, fundraising, providing PPE to people that don't have it.
Partners and volunteers within San Benito Health Foundation since the beginning of this pandemic.
In an email to KION, CDPH says, quote, they are community health workers at that point and became eligible for, though not guaranteed, a vaccine. Documents show prioritized IHSS workers accounted for 31% of the foundation's January doses. But as of January 22nd, a substantial amount of people, 65 to 74, and food and ag workers received more than any other group. Neither group was eligible in San Benito until January 25th.
That's a deserving group. You can maybe split some hairs between who's more deserving, but the allocation guidelines were pretty clear.
The foundation doesn't deny this either and say many on the county list weren't interested. They also took their directions from a January 14th memo from CDPH. If you have available supply, you can prioritize and target outreach efforts to people working in Phase 1B sectors.
You have maybe 10 people in that household or even more, and it is not the grandpa and the grandmas that are not, that are staying at home. It is all the other individuals.
But until March, counties had the final say for eligibility. The foundation is now getting the vaccine again, but under the condition of a zero-tolerance policy. And as for that zero-tolerance policy, one more documented misstep, and the county is going to notify federal authorities who have legal oversight to federally qualified health centers.